नमस्ते। SGVP हॉलिस्टिक हॉस्पिटल में आज हमारे साथ है डॉक्टर तनिषा। अक्टूबर मंथ एज अ ब्रेस्ट कैंसर अवेयरनेस है, तो हम उनसे जानेंगे कि ब्रेस्ट कैंसर क्या होता है, उसमें क्या करते हैं और कैसे सिम्टम्स होते हैं। इन डिटेल हम सर के साथ जानेंगे। सर इज़ अ सर्जिकल ऑन्कोलॉजिस्ट जो 5 साल से SGVP में काम कर रहे हैं, और अब हम उन सर से पूछेंगे कि सर प्लीज़ इन डिटेल हमें बताइए। नमस्ते सर।
नमस्ते श्रेया, नमस्ते आपकी ऑडियंस को भी।
सर आप प्लीज़ हमें बताएंगे आजकल इंडिया में कौन से कैंसर मोस्टली देखने में मिलते हैं?
जी ज़रूर। इंडिया में मोस्ट कॉमन कैंसर ब्रेस्ट कैंसर है। हालांकि ज़्यादा से ज़्यादा एक ही जेंडर में होने वाला कैंसर होने के बावजूद सबसे ज़्यादा नंबर में रीसेंट डेटा के अकॉर्डिंगली ब्रेस्ट कैंसर सबसे कॉमन कैंसर है। फीमेल में लीडिंग कैंसर एज वेल एज लीडिंग कॉज ऑफ कैंसर रिलेटेड डेथ भी ब्रेस्ट कैंसर है, और मेल्स में जो है वो मुंह के और गले के कैंसर भी ज़्यादा कॉमन है।
सर ब्रेस्ट कैंसर क्या है, थोड़ा कुछ डिटेल में बताएंगे हमें?
श्योर। ब्रेस्ट कैंसर जो है वो ब्रेस्ट में जो मिल्क डक्ट्स एंड मिल्क लोब्यूल्स होते हैं, जो मिल्क फॉर्मेशन में हेल्प करते हैं, उसके लाइनिंग एपिथेलियम में से अराइज होने वाला एक कैंसर है, जिसकी ग्रोथ जो है वो नॉर्मल ब्रेस्ट टिश्यू के कंपैरिजन में अनकंट्रोल्ड हो जाती है, और वो एक गठान के रूप में हमें मालूम पड़ता है।
सर ऐसे कौन से सिम्टम्स है जो यूजुअली हम देखें और हमें पता चले कि हाँ वी आर अफेक्टेड बाय ब्रेस्ट कैंसर?
जो ब्रेस्ट कैंसर का सबसे कॉमन सिम्टम है वो एक ब्रेस्ट में गठान होना या तो लंप होना, जो ज़्यादातर पेनलेस होता है। तो यूजुअली जो ब्रेस्ट कैंसर रिलेटेड लंप्स होते हैं वो पेनलेस होते हैं। इन ऑलमोस्ट 90 to 95% ऑफ द ब्रेस्ट कैंसर पेशेंट्स they start with a painless lump in the breast. Other symptoms can be discharge from the nipple, which is slightly reddish in color. Sometimes जो skin होती है, overlying skin of the breast, उसमें कुछ changes आ जाते हैं, skin के ऊपर redness हो जाती है, कई बार skin जो है वो अंदर की तरफ खींची मालूम पड़ती है, या कई बार एक्जिला में या अंडर आर्म्स में कोई गठान जैसा महसूस होता है। तो ये सारे जो है वो ब्रेस्ट कैंसर के लक्षण हो सकते हैं।
सर ऐसी कौन सी कॉमन एज है जो यूजुअली ब्रेस्ट कैंसर से अफेक्ट होती है?
सो यूजुअली आज से एक दशक पहले, मतलब आज से 10 साल पहले तक कॉमन एज ऑफ प्रेजेंटेशन जो थी वो अराउंड 55-60 ईयर्स के आसपास रहती थी इंडिया में। लेकिन आजकल हम काफ़ी यंग पेशेंट्स में भी ब्रेस्ट कैंसर देख रहे हैं। जैसे अभी अराउंड 20 to 30% जो पेशेंट्स है वो हमारे पास 40-50 साल की उम्र के बीच में भी आजकल देखने को मिल रहे हैं। अदरवाइज इसकी यूजुअल एज ऑफ प्रेजेंटेशन अराउंड 60s है।
सर इफ अ प्रेग्नेंट लेडी इज डायग्नोस्ड विद अ ब्रेस्ट कैंसर, तो क्या चांसेस है कि वो कैंसर के इवन अ स्मॉल पार्टिकल्स उसके किड में, मतलब चाइल्ड में ना आए?
दिस इज अ वेरी इंटरेस्टिंग क्वेश्चन, बट लकीली द आंसर इज द ब्रेस्ट कैंसर कैन नॉट स्प्रेड फ्रॉम अ प्रेग्नेंट लेडी टू द अनबॉर्न चाइल्ड। वो इस तरह से फैलता नहीं है। सो इफ अ प्रेग्नेंट लेडी इज डायग्नोज्ड विद ब्रेस्ट कैंसर, हर चाइल्ड डेवलपिंग एनी ब्रेस्ट कैंसर even at birth or even sometimes later in his or her lifetime is very less, or it is not because of the mother being suffered from breast cancer during her pregnancy. So आने वाले बच्चे को मदर की प्रेगनेंसी के दौरान ब्रेस्ट कैंसर होने की वजह से कोई एडिशनल रिस्क नहीं रहता ब्रेस्ट कैंसर होने का।
सर अगर कोई फीमेल लेडी है जो इज अफेक्टेड बाय ब्रेस्ट कैंसर, अगर वो अपने बेबी को ब्रेस्ट फीडिंग करती है तो चांसेस है कि कुछ स्प्रेड हो या ऐसा कोई भी डिसीज?
सो पर से ब्रेस्ट फीडिंग की वजह से ब्रेस्ट कैंसर के सेल स्प्रेड नहीं होते बच्चे में। पर उस लेडी का अगर कोई ट्रीटमेंट चालू है, जैसे डिलीवरी के बाद उनका कोई ट्रीटमेंट चालू है, जैसे कीमो चालू है, या फिर कुछ कुछ केसेस में एंटी ईस्ट्रोजन हार्मोन की गोलियां चल रही होती है मरीज को, तो उस केसेस में हम ब्रेस्ट फीडिंग अलाउ नहीं करते, क्योंकि ये जो ड्रग्स है वो ब्रेस्ट मिल्क में सीक्रेट हो जाती है, और जो फीडिंग चाइल्ड है, जो बच्चा है, उसको नुकसान पहुंचा सकती है। बट कैंसर नहीं फैल सकता ब्रेस्ट मिल्क के जरिए।
ओके सर, व्हाट आर द रिस्क फैक्टर्स ऑफ ब्रेस्ट कैंसर?
So risk factors for breast cancer can be classified as the ones which are modifiable risk factors and the others are non-modifiable risk factors. The modifiable risk factors are the ones which are related to lifestyle. जैसे हम देखें कि आजकल जो नॉर्मल एज ऑफ मैरिज है that has gone beyond 30 in the affluent society strata. So that can be one of the reasons. If you have your first child beyond the age of 30, that definitely puts you at a higher risk of developing breast cancer. If a lady does not breastfeed the child or does not adequately breastfeed the child, then also it becomes a risk factor. Obesity is a risk factor. In some cases जो पोस्ट मेनोपॉजल फीमेल्स होती है, जो मेनोपॉज रिलेटेड सिम्टम्स होते हैं, उसको ट्रीट करने के लिए हार्मोन रिप्लेसमेंट थेरेपीज लेती है. So then that hormone replacement therapy containing estrogen also is a risk factor. So these are some of the modifiable risk factors which we can control by ourselves. There are certain non-modifiable risk factors also. If a woman's reproductive lifespan is more, say for example somebody who has started menstruating at an earlier age and has a menopause at a later age, so her reproductive lifespan, if that is more, so her risk of developing breast cancer would be more compared to a lady with a shorter reproductive lifespan. Another non-modifiable risk factor एक genetic basis हो सकता है. कई सारे ऐसे जीन्स है, जैसे आप लोगों ने सुना ही होगा कि BRCA करके एक BRCA करके जीन होता है. If that gene or some other genes which are known to cause breast cancer, if there is a mutation in that, so then that also can be the cause of breast cancer. But again, this is a non-modifiable risk factor, so we cannot control on our own. So it is inherited. What we can do is we can, if somebody is at a higher risk, say for example somebody has got a very strong family history of breast cancer or ovarian cancer or some intestinal cancers, so that individual can be tested for certain genetic mutations, and if these sort of genetic mutations are there, we can take some preventive actions against them.
Sir, what is the correct process to cure the breast cancer?
So the cure of the breast cancer depends upon the stage at which the patient is diagnosed. In early stages, surgery is the first treatment option to be offered to the patient. Surgery can be in the form of whole breast removal, or in many of the cases nowadays we can very well conserve the breast and get rid of the cancer. So after the biopsy report is available post surgery in early breast cancer cases, early stages, so if the biopsy report is suggestive of some other risk factors, then that lady may require chemotherapy with or without radiation, and in some cases hormonal therapy also, which is available in the form of simple oral pills. If a lady is diagnosed at a locally advanced stage or advanced stage, then we may offer her chemotherapy first, which is to be given through this injectable route, and after the response to chemotherapy, if that is good, then we offer surgery to that lady, followed by radiation, and in some cases again the hormonal pills.
Sir, other than chemotherapy, radiology and any kind of surgery, is there any other way to cure this kind of disease, like pills or anything?
So apart from the conventional surgery, chemotherapy and radiation, the other modalities of cure, they solely depend upon the stage as well as the type of the breast cancer. Certain types of breast cancer like triple negative breast cancer, they can be benefited by giving these patients the options of immunotherapy also. Other modality available is the hormonal pills, which I was talking about in your last question. So some of the cancers, if they are responding to estrogen, so we can simply give the anti-estrogen pills to the patient, and that shall also take care of any future recurrence of the breast cancer. And in some cases, certain targeted therapies which are actually given by IV route or subcutaneous route, so they are systemic therapy, but they are different from chemotherapy, that they are more precise in their the treatment. So they mainly act on a particular target, and then so subsequently they have less side effects compared to chemotherapy.
Sir, are there any precautions which we can take to prevent cancer, or any kind of activities which we can help?
Yes, definitely, because breast cancer nowadays is very common. The data suggests that worldwide it can affect 1 in 10 ladies. Fortunately, in India, the rate is 1 in 22 ladies in urban population and 1 in 58 to 60 in the rural population. But there is definite prevention available by means of screening. Screening is a modality in which we can pick up the cancer before it actually manifests. So, किसी बीमारी के सिम्टम आने से पहले अगर हम उसको पकड़ सके, उसको स्क्रीनिंग बोलते हैं. So what we do is we encourage all females above the age of 40 to undergo a yearly mammogram, irrespective of whether they do have any issues with their breast or not. But a yearly mammogram is must. Along with that, we teach them breast self-examination and when to report to your doctor. Along with that, we can call them for 6-monthly clinical breast examination also. So there are a lot of preventive modalities available, but a yearly screening mammogram is must and should be included as a part of screening program in our country, which is very much prevalent in the Western world.
Sir, what is the possibility of successfully recovery of the breast cancer?
So it all depends on the stage at which a patient is diagnosed. For early stages like stage 1 and 2 and with favorable histology, the cure rate is more than 95% in some cases and up to 85 to 90% in certain other histologies. If a patient is diagnosed at a locally advanced stage, say for example stage 3, then the rate of cure or a 5-year survival can be considered as somewhere between 60 to 70%. Again, apart from the stage, it depends on what kind of histology or what subtype of breast cancer the patient is suffering from. But roughly, we can say that stage 3 locally advanced cancers, they survive, the 5-year survival rate is 60 to 70%. And for the advanced stages like stage 4, where the cancer has spread to the distant organs, so in that case, the survival rate can vary depending upon the subtype of the breast cancer, starting from 10% to anywhere between 40 to 50%.
Can a person get affected again once she is recovered completely from the breast cancer?
Yes, she can. Practically, she can. If a lady does not complete the entire treatment, whatever has been suggested by the doctor as per her stage and the disease type, if she does not complete, then her chances of recurrence are more. Even if she does complete, but at the time of diagnosis, if the stage is slightly higher, then her risk of recurrence is definitely there. And that is why we usually call our patients for routine follow-up every 6 monthly till they complete 5 years of treatment. And even after 5 years, we call them every yearly to just make sure that she's not recurring. But whatever chances of recurrence are there, they are usually within up to 2 years after completion of treatment and at the most till 5 years. What we assume is from our practice that if a lady does not recur for 5 years after completion of the treatment, then her chances of getting the breast cancer will be almost equal or equivalent to a normal person getting breast cancer.
Would you like to give an ending statement along with the awareness for especially the Breast Cancer Awareness Month?
So October being Breast Cancer Awareness Month, I would like to give this message that breast cancer is the most common cancer occurring in females worldwide as well as in India. Certain risk factors are in our control, so we should be taking care of that. We should have a normal, healthy lifestyle and we should participate. And as a clinician, I encourage my patients and their caregivers to participate in the screening programs. That is just getting a mammogram done yearly, even if you don't have any issues pertaining to your breast. So if somebody is detected by means of screening, the stage at diagnosis is very less. So that lady requires very minimum treatment and the results are almost practically 100% cure. So that is the message I want to give you, that participate in the screening activities as much as possible. To my patients, I would like to say them that encourage your relatives to get their mammograms yearly after the age of 40 years. Thank you.
Thank you so much, sir, for joining with us on the podcast. It was so nice to know more in-depth details regarding breast cancer awareness. And thank you once again to being a part of this podcast.
Thank you.
SGVP Holistic Hospital.